Okay, let me see. Okay, that's great.
Yes.
Well, thank you so much, everyone, for being here. We have a great session planned for today. We have Carley, who is our guest of honor. Um, so Carley, I would love for you to just quickly introduce yourself and tell us uh what interested you in getting involved with our group, and also I know what interests you about mental health and how you got involved in that, and yeah, how does that fit in your life?
Yeah, so thank you. I was introduced to this group by my surgeon. I am also a spina bifida patient. So I kind of just fit. I got into mental health around undergrad. I did my undergrad in psychology. I'll kind of go over my educational background in the PowerPoint. Yeah, I just got really into mental health and noticed that when I was having surgeries that there wasn't a lot of mental health support for patients. Yeah, so that's kind of what got me into this. Yeah.
Yeah, thank you so much for sharing that. And Carly, you're doing a master's degree right now, or is it a PhD?
Master's degree.
Master's degree. Okay, so we have a professional in the house to talk to us about mental health. I love it. So then if it's okay with you, I can share the slides, I can get us started, and then I know you're gonna take it from there.
Sure.
Alrighty, perfect. Just one moment. I have way too many tabs opened. Hmm. Let's see. Okay, so I'm hoping that you all can see my screen. All right, so I'll just get us started on our presentation on living mindfully, sorry. Um, okay, let's see. Okay. So very quickly, we're just going to go through some stress management, self-care, wellness, and then at the end, we're going to have a quick activity. Sorry, Carly, I know I asked you to introduce yourself out of order, but if you have anything else that you want to share, please go ahead. Yeah.
Yeah, so like I said, I have a bachelor's degree in psychology. I emphasized in clinical counseling and school psychology. I am in my third year and final year. I have 2.5 more semesters left of my master's degree, and I'm finishing up my graduate certification in child, adolescent, and play therapy. So some of my professional interests include like medical play therapy, medical trauma, and improving mental health support for pediatric and transitional urology patients. Like I said, I'm a spina bifida patient myself and currently trying to adjust living with a urostomy and, adjusting the ups and downs to that journey. It's been a wild, not so fun journey, but it's getting there. So some fun facts about me. I love watching Supernatural. That's like my way of doing self-care. And I also have two cats named Asher and Zoe. They're like my children, so I don't have human children myself. So yeah.
Well, maybe the cats will make an appearance.
Maybe, I don't know.
Oh. Okay, okay. Well, thank you so much for sharing that. Um, let's see. Let me keep going. Okay. So, yeah. So, very quickly, what is stress? Stress, normal reaction to everyday pressures. But what happens when stress becomes unhealthy, when it's happening every single day, maybe many hours a day. It can really upset your day-to-day functioning. It can really affect your quality of life as well. um And stress can really affect almost every single organ or system in your body. And then when it happens so often, it becomes such a big part of your life, it can also interfere with your ability to just live a normal life for an extended period. And it can become dangerous. The longer stress lasts, the worse it is for your mind and your body. You can start to
And,
feel fatigued.
and yeah, go ahead, Rebecca. Sorry, I just wanted to add a note after this, after you're done.
Yeah, you can feel fatigued. You might have issues concentrating. You might even notice that your mood can change. You can become irritable. Um, but yeah, it can also cause wear and tear to your body, that we might not really think of as much. But yeah, Alan, go ahead.
Yeah, I just wanted to point out the little graph on the right side, and really what I wanted to do there with that visual is to give a representation of the effects that stress can have over time, and that initially we have this alarm reaction, and then we have a resistance phase in which we have a really good ability to combat stress. But what happens after a little while in that exhaustion phase is your ability to deal with stress really starts to go down pretty quickly, and that's when a lot of these body systems that Rebecca was talking about, really our cardiovascular system, our lungs, our brain, our muscles, all these things, it gets harder and harder to fight off the effects of stress. And I think this is just really emphasizing why a presentation like this is so important, and really developing good ways to handle this so none of us ever reach that exhaustion phase in the graph.
I also want to point out for that, so you want to think this as a cycle. So, if you can't complete the stress cycle, the body repeats the stress response.
Gotta
So
break
it's
the
just going to
cycle.
keep going. Yeah.
Wow, thank you so much for sharing that. And I really love this graph, Alan. It really puts things into perspective in a way. Um, just keep it up long enough, and your body's just maybe not going to be able to handle it as well as maybe you did at the beginning. So yeah, like Alan was mentioning, and like I said earlier, stress affects every single system in your body. It can lead to issues with your heart, high blood pressure, can lead to issues with your sugar, digestive issues. Maybe you're not digesting as fast as you used to, or maybe you're having issues going to the bathroom. It can lead to anxiety and depression and headaches, and it can really weaken your immune system. If anyone's gone through longer periods of stress, or just like, yeah, longer periods of stress, you might have noticed that sometimes you get sick more often. Or maybe that's just me. I don't know. I've definitely seen it happen to myself. Um, but yeah, I don't know, Alan, if you had anything else to add to that.
No, I think that was great. Just again, just want to reemphasize for the fourth time tonight, just saying it again, how it really does impact everything, even if you might not feel it immediately. You might not see it immediately. It really is just so important to understand kind of the widespread effects and good ways to deal with it. Thanks, Rebecca.
Yeah, so I think this is where I give it back to you, Carley.
Okay. So I kind of want to talk about some stress management.
Sorry.
Yeah, yeah. So I think one of the most important parts to start with is examining the source of your stress. This can look like, journaling and writing it down. So writing the cause and like creating a solution that fits for you. Also like connecting with others, connecting with family, friends can be really important to manage stress. Getting some rest. Sleep is really important. If you're not sleeping, you're going to be more stressed. Engaging in movement, whichever way that looks like for you, it's going to be different for everybody, and that's okay. And then meditation. Um, it definitely takes practice, and I know not everybody is into meditation, but it can be a good way to manage stress. And then laughter. I tell people it's important to laugh every day. And I have some science behind laughter and like why it's important. So it triggers the release of what is known as like the feel-good hormones. These can include like endorphins, serotonin, dopamine, oxytocin, and then it also reduces the level of stress hormones like cortisol and epinephrine, also known as like adrenaline. And then like getting help, psychotherapy. I will mention this multiple times. Counseling is great to manage stress. And I tell people all the time, like, you do not need to have a significant mental health condition to seek out counseling. I think anybody can benefit from it in one way, shape, or form.
Yeah, thank you for sharing that. I will say, coming from maybe a cultural background where psychotherapy and even medication is not it's kind of frowned upon in a way, you know? I think it was very new to me. Like maybe like a year or two ago, I was having a hard time and I started doing therapy, and it was very acute. So after a while it was fine, but I kept going because it has changed my life and how I really see myself and how I go about really managing stress. Every single small little things in a day, it has really like changed a lot of like my perspectives on mental health and whatnot. So I'm a huge advocate. I know nothing about mental health, but I know how much I've enjoyed therapy and how much it has impacted my life. So I tell everyone,
Yeah.
therapy.
It has made like a huge, it's a huge part of my week too. I think definitely going through multiple medical procedures, it's just a great way to like help process and, you know, oftentimes like having medical procedures and medical conditions, you grieve. And it's just a great space to be able to do that.
Yeah.
Yeah.
And Carley, I just saw your message that you started counseling too. So that's very exciting. Thank you for sharing that. Maybe you want to tell us later on how that's going. But yeah, to the other Carley. Please go ahead.
So next I'm going to talk about self-care. I think self-care can be a really important part in stress management. Um, so self-care is not about self-indulgence or being selfish. It really means taking care of yourself so that you can be healthy, you can be well, and you can help care for yourself and others. And you can do all the things you need to accomplish in a day. Some benefits to self-care include like increased capacity to manage stress, relief of anxiety, depression, and other issues related to emotional health, having better sleep, improved immune response, positive health outcomes, and improved productivity. So this is the self-care wheel. We kind of think of self-care as like 6 different parts: physical, psychological, emotional, spiritual, personal, and professional. I'm going to go into depth 5 of these, and I'm going to leave out professional just to um, respect that not everybody is able to have a job. Um, but there's also like professional part of self-care too. So for the first part of self-care is physical. It's also like the most common, or the one you'll hear the most. So physical self-care is the practice of improving or maintaining the health and wellness of your body. So some examples can be like staying hydrated, drinking lots of water, fueling your body with healthy foods, getting enough sleep, scheduling wellness visits, and attending all medical appointments, which I know could be really hard, especially with a chronic medical condition, because you're having to manage multiple appointments and multiple doctors and making sure you're keeping that organized. And it can be really overwhelming, but it's super important in your physical self care. And start your day off with a good morning routine that incorporates calm and peace to your day. Some of this can include like a daily affirmation, taking some deep breaths or meditating, or any other way that provides you calm and peace. So I wanted to ask, what are some other ways in which you can ensure you're engaging in self-care, physical self-care?
I saw your tiny little son in there, and I will say that I can go many, many days, sometimes weeks, without getting much sun. And I am very bad about going outside and getting a little bit of sun. I'm better at it when it's summer, but I did notice like how much of a difference in my, just in the way that I felt and in the way that I saw life, and that I saw when things came at me, how I like, um how I reacted. So I think that, yeah, for me specifically, just getting some sun, going outside seems to have such an important effect. And when it comes to winter, goes out the window. But yeah, I just need to be a little bit better about that, I think.
I also think for me, hi, I'm Peter. I'm new here. Just checking out the group, but excited to be here. But for me, I think breathing is a big one for my physical self-care. Just taking a moment, if it's a stressful day or a lot's going on around you, to just take a few deep breaths. It can really make you feel better and just kind of ground you in what you're doing.
I love that idea. Yeah.
For me, I like to do art and I like to write, cause and listen to music and watch TV shows for music, or what TV shows or movies, because it can really help you get out of your own head for a little while.
Yes. Yeah. I think for me is allowing myself to rest. I know being in grad school, like oftentimes I like struggle like going 100 miles an hour. Yeah, allowing myself to rest and not feeling guilty about it.
That's a hard one, but yeah.
Yeah. Yeah. Awesome. So the next form of self-care is psychological. This refers to activities that help you maintain your mental health and well-being. So, some examples can be like self-reflection, of reflecting on your day or your week. Um, Again, counseling is great to improve psychological self-care, and then journaling. There's really great resources on Google that gives you daily journaling topics, and then practicing relaxation, getting enough sleep, reflecting up on your strengths. I think is super important. I always talk to clients that it's really important to focus on what you're good at and your strengths, and kind of move away from the negative thoughts. I think oftentimes we focus on the negative, and it's really important to focus on the positive. And then practice asking and receiving help. This can look very different for everybody. Whether it's counseling or asking help from a family member or a friend or your medical team. If you're struggling, don't be afraid to ask for help. And then investing in hobbies, like we said, for the physical, art and painting, planting, can be a good way to, whatever interests you and whatever is going to provide you peace. Yeah. So next is emotional self-care. This refers to the act of becoming aware of and identifying what you're feeling. So one great way is providing or incorporating daily affirmations within your routine. Some affirmations I use is, I'm capable, strong, and worthy, and always enough. I'm worthy of respect from myself and others. I have the mind, heart, and soul of a warrior. I was wondering if anybody else has any other daily affirmations or sayings that you need for yourself.
I These are not daily affirmations, but I think that when I am feeling most insecure. I do say this a lot. A friend of mine actually told me this affirmation a while back, and I was like, I actually love that. I'm gonna incorporate that into mine. Not my routine, but I'm gonna incorporate that somehow. And it's
something or
I'm strong, I'm capable, and I deserve to be here.
do we just have
Um,
something going on?
Yeah, I think that one just comes from my own issues, like my own insecurities from being a student. But yeah, I'm strong, I'm capable, and I deserve to be here.
Yes, I love that.
One that I use. Sorry for interrupting if I did.
You're
No,
good.
no, go ahead.
Okay, sorry, there's just a lot going on here. One that I use is also from a TV show that Carly and I have in common. Is from an actor named Jared Padalecki, who also struggles with mental health himself. And he started a campaign called You Are Not Alone. And it helps remind people that there are other people out there that struggle, and that you just have to know where to look to find somebody to grab onto that'll be there to help you. And that's one for me that really helps me and means a lot for me.
Yes, thank you for sharing. Some other ways for emotional self-care can be connection. Like I said previously, connecting with family members or friends, connecting with a pet. Also practicing self-love and self-compassion, and allowing yourself to make mistakes and provide yourself grace. So it's okay to make mistakes. You're not perfect. No one's perfect. And then set and enforce your own boundaries and being okay saying no. So next is spiritual self-care. So this is establishing a connection with one's higher real self. So this can look like a prayer if you practice any religion or meditation. And then creating a sacred space just for you and your relaxation. Connecting with a pet. Taking moments of silence. Practicing gratitude and compassion. And then connecting with a community of like-minded people who share your values and beliefs. And then spending time in nature, being outside. So next is personal self-care, and this really is very different between each person. So just some ideas can be like practicing good sleep hygiene. Again, learning a new hobby that you really wanted to try, but you just haven't yet. Reflecting on any short-term or long-term goals that you have and treating yourself, especially in times of struggle. Allowing yourself to have a treat or some grace. And then listening to music. I love listening to music. That's definitely part of my self-care routine. Yeah, so next I want to go over some signs that you might be lacking in self-care. So oftentimes I will talk with clients about self-care is you can have a plan of self-care, but how will you know that you need to incorporate self-care? Best way is listen to your body. What is your body telling you? Some signs can include like feeling overwhelmed and stressed. You might get sick more often, just like when we talked about stress management and you're super stressed, your immune system is going to suffer. And then increased moodiness. If you might be more anxious and more depressed, more times of low mood. Some unpleasant physical symptoms, including like headaches, low energy, or chronic pain. You might have trouble like falling asleep or staying asleep, and then feeling burnout, and then difficulty concentrating as well. So next I want to go over mindfulness. So mindfulness is a state of active, open attention to the present. The state is described as observing one's thoughts and feelings without judging them as good or bad. And then mindfulness is just a way to be present. It's a good tool to help avoid self-criticism and judgment while identifying and managing difficult emotions. It can also be used to address stress, anxiety, pain, and become more relaxed. Some ways to practice mindfulness, which there's only 3 on here, but there's many different ways to practice mindfulness. One way is practicing deep breathing, especially, maybe in the morning or times of worry or stress. Deep breathing is a great way to calm your mind. And then mindful movement, whatever that looks like for you. That can be chair yoga, playing with a pet, or taking a walk outside. And then mindful meditation, allowing yourself to be present in the moment. Yeah, so next we're gonna do our activity. So I would like for everybody to have a piece of paper, something to write with. So you're gonna make 5 sections. One being physical, psychological, emotional, spiritual, and personal, like the 5 areas of stress, or 5 areas of self-care that we talked about. And write down in each section like activities that fit within your routine and lifestyle. And then if you want to like give me a thumbs up or something when you're done, and I'll go over like the next part of that.
Yeah, I think maybe take the next like 2 minutes or so. Does that sound good?
Yeah.
Okay, how are we feeling? Have we had enough time, or do we want a little bit more time?
Maybe like 2 more minutes.
Sounds good.
I can explain the next part of the activity if everybody's ready.
Yeah, Carly, I think,
Okay.
go ahead. Yeah.
So all these like may seem like very overwhelming. This is probably a lot to think about. So I want to challenge you to think of like one area that needs the most attention for you. And then if you want to share what area that is and like what kind of self-care activities did you incorporate in that area?
One of my biggest issues is asking for help and letting people help. I'm used to doing everything myself. I'm used to being independent. And as I have gotten older, this is a lot tougher than it used to be. And sometimes I need more help. I'm not used to asking.
Yes, asking for help can be very difficult. I definitely struggle with that too. Thank you for sharing.
My goal is to ask for help more often and let people do it.
That is a good goal.
Marsh, I think to piggyback on that, I think that I feel very similarly. I think that, I came to the US when I was so young and I had to figure everything out on my own. And
Mm.
there came a moment and I was like, I can do it. I have figured it out so far. I can keep going without needing any help. And it wasn't until very recently, and I would say recently, like a year or two ago, that I realized I have gone really far without any help, but I don't think that asking for help is really going to take away from, who I am any more than I think help me achieve exactly what I need or, help me be who I want to be. So it's been kind of really tough, especially I think for me has been very much in like the sense of looking for mentorships and things like that, guidance. And it was really tough making those first steps, of asking someone to like sit with me and talk to me about something that have questions about. But now that I've done it, I think it's been really, really like rewarding. So I think that making those first steps is so hard, but it's gonna be okay. The people around you love you and are probably very happy to help you. Um, I think that for me, also it's just like personal life, like there's so much that I want to do and there's definitely not enough time. So I really have been putting off like the things that I like to do to be able to accomplish what I need to do. And you can only do that for so long. So I'm finding myself in this area where I need to maybe take a step back from you know trying to not accomplish all these things, but like maybe make it more manageable and like give myself the time that I need and want to see my friends, to watch a movie, um to try out a new hobby that I've been wanting to try out for years. So I sometimes it's a give and take kind of thing.
Yes, thank you. Yeah, self-care is something that like you have to practice, and we're not striving for perfection. it's okay for some weeks to not have good self-care.
Some that I wrote down. So for the first one, some of the ways that I deal with it are doing things like mandalas, because they're just like little pages that you color, and you don't really think about anything except for the shapes that you're coloring in, and so it kind of helps you calm down and like go away from what you're thinking about that's making you have that anxiety and stress. And another one is talking to friends, and writing or drawing. And one of the things for the second part, one of the things that I struggle with is like the psychological, emotional part. And one of the things that I do to handle that is talking to friends and listening to music, because those also really help me get out of my own head for a little while. Because just sometimes being in your own head just kind of makes it worse, because you just kind of think about things over and over and over again, and it's like a big old loop that doesn't end. So that helps me.
Yes, thank you for sharing. Yeah, it's really hard to get out of your own head, especially those racing thoughts. Music is a
Right.
great way to help with that, and definitely coloring
hmm
definitely like calms the mind.
hmm
Yeah, thank you. Wanted to give space for anybody else that wanted to share before I share mine.
I can share. I think the first one that I let go is always physical. When I get stressed out and feel like I have 100 million things to do, I tend to stop going to the gym and working out, or just stop getting daily exercise. And I think that, well, I think it might help in the short term because I have so much on my plate, and I'm like, oh, it'll buy me an hour. In the long term, I'm just less productive with all the rest of my time, and things build up more. So it kind of backfires.
Yes, yeah. It's really hard to focus on your physical self-care when you're going 100 miles an hour. I definitely relate to that. Yeah. Thank you for sharing. Yeah, I can share mine. My area that needs the most attention, I would say, is also physical self-care. Um, Especially being in grad school and now seeing clients full time. I feel like I'm constantly like running around, and I really struggle to like eat 3 meals a day and care for my basic needs. I really want to start like spending time outside and focusing on getting more rest, and like, the simple things like your basic needs. Some days I struggle with, and it's okay because we're human, we're not perfect. It's okay to struggle sometimes.
Carly, something that I wanted to point out that was very like surprising to me was the way in which for example, when you said physical like well-being, I immediately think working out. But there was so many things that you included that did have nothing to do with it. And that makes so much sense to me, but that I don't think about. Like you
Yeah.
just said, eating 3 meals a day. Sometimes I literally have one single boiled egg a day, because I'm so busy. I'm like running around. I forget that I need to eat. And then so much time goes by, I drink no water. And it's so, I think, I don't know, I was just so surprised because it makes so much sense, that you're taking care of your body in so many different ways. But I also think that I view like well-being in such small little categories that only fit like one single thing almost, So I think I found your presentation, if anything, very like enlightening in like there is so many different ways in which you can take care of yourself that I'm not thinking about, you know?
Thank you. Yeah, I think oftentimes we get so busy and our basic needs get neglected, which really can impact you long term.
I
Let's
have
see.
to leave, and I just wanted to let you know that I found this very valuable, and I really appreciate all of your time. And Rebecca, it was great to see you again. Love you. Hope we
Thank
can
you,
get together
Mark.
one of these times.
I
You
hope to see
take
you
care,
next
girl.
time. Yeah. Have a good rest of your day. Thank you for being here.
Yeah, thank
Um,
you. Love you.
Carly, I'm trying to like keep going and it's not going. I don't know. Let's see. Was that the last slide? Or am I?
Yes.
Oh, that was the
Yep.
last slide. Yes. Okay. Well, I found that activity so eye-opening in so many different ways. Um, I don't know what anyone else's thought was, but I just, like I said, every time, like, even when my therapist tells me self-care, I'm like, okay, but what do I even do? What is there for me to do? So I love that you included so many different things that I never even thought of.
Yeah, thank you. I know self-care is can feel overwhelming, but I really appreciate that you enjoy the activity. Like breaks it down a little bit easier to handle.
And then I will also say, it feels like often it feels like self-care is expensive, you know, because we think hobbies.
Mm.
And I recently wanted to start crocheting, so expensive. But then once again, when you broke it down in all these different things that you could do, it was like, look at all these things that I can do that are not necessarily like going to cost me money and that I can just include into my life. Um, I mean, once again, mental health is expensive, but we can, I think, do the things that are within our budget. Like there are many ways to go about self-care that I think can be budget friendly.
And self-care does not always have to cost you any money. It can be as simple as like taking a walk.
Or even just hanging out with your niece and nephew.
Exactly. Yes. Or watching a movie or sleeping. Yeah.
Yeah, totally. I think for me specifically, like hanging out with my friends, like you said, Carly, like talking to my friends, hanging out with my friends, the best therapy. I mean, I'll still go to my therapist, but so good.
Yeah, sometimes your friends know you better, and then they can basically be your therapy for a little sometimes. Because your friends know you better than anybody.
Yeah. They can definitely be very supportive. I agree with that. Yeah.
And I just realized that you were probably talking to the other Carly. Sorry about that.
No, I was talking to both of you
Oh,
and everyone in
okay.
this room. Thank you so much
Okay.
for participating. I really appreciate it, honestly. Thank you for sharing, Carly.
I'm
Yeah, you're
thinking I should
welcome.
put I'm thinking
Oh,
I should put my name back to Phoenix because two Carlys it's going to be very confusing.
Should we do Carly 1, Carly 2? No, no, just kidding.
Just call me Phoenix. It's fine.
Okay. All right. Um, yeah, I think that we've kind of hopefully have shared some good resources. Carly was so great in helping putting this presentation together and such a great resource because this is literally her profession. So I don't know if there is any specific questions that we have for Carley before we kind of like wrap it up. Carley, Baker, any last thoughts that you want to leave us with?
Not really. Just that, self-care takes practice, and we're shooting for progress, not perfection. Practice makes progress, not perfection. And it's okay to have weeks for your self-care is not good.
Thank you for reminding us of that, because I think that I really struggle with that. Sometimes I'll go with my therapist and I'm like, look at me where I'm at again. What's going on? She's like, sometimes we have like bad days. It's okay. Like, give yourself some grace. So I've been practicing that, and it's hard, but yeah, thank you for reminding us. I think that we just need to have it on repeat sometimes, have it recorded. Just play it when we need it. We're striving for progress, not perfection. I like that. Maybe I'll make that one of my daily affirmations.
Yes, I love that.
Okay, well, I think I'm gonna stop recording now.